We're getting a glimpse at what the upcoming school year could look like, courtesy of a few districts that have already started their fall terms. Among them, that high school in Georgia that earned national scrutiny for viral images posted by a student showing crowded hallways and very few masks. As it happens, yesterday, the superintendent of that district contacted parents because at least 9 people tested positive for the virus. So those students are back at home today and tomorrow, doing online classes only, while administrators do what they call a deep clean. Parents won't know if their kids will be going to school on Wednesday until Tuesday night. That, as a new report from the American Academy of Pediatrics and the Children's Hospital Association finds that at least 97,000 children in the United States tested positive in just the final 2 weeks of July. That's a 40% increase from the total number of cases before that period. That brings the total number up to an estimated 338,000 cases reported among children since the pandemic began. Joining us now is Dr. Vin Gupta, global health policy expert and MSNBC medical contributor. Let me start with that last statistic, about 97,000 in just the last couple of weeks of July. What's your sense? What's happening here? Is it more testing? Is it because it's summer and kids are out running around? What do you take away from those numbers?
Good morning. Oh, good afternoon, Chris. The big take home here, and it's really important to emphasize this, is the majority of those new cases are in southern and western states led by Arizona. And that's important, Chris, because yes, testing has increased in states that are known hot zones. But what was less clear because of poor messaging from the top, from the president, was, are children immune? And this data, in addition to a ream of other data prior to it, should put that to rest. So every parent and every school district in every part of the country should be very clear. Children, your children are not immune. Teachers that go into these schools that are still opening, you're still at risk, as are children. So that number one is really important to emphasize, Chris, that places that are seeing outbreaks, high spikes like Arizona, community transmission is happening. Schools are not being spared. Children are not being spared. So that's the main reason why you're seeing what you're seeing.
Yeah, one of the examples today, for example, the governor of Georgia ruled out ordering masks being mandatory in public school systems. He said, you know what, let's leave that up to each individual school system. Does it still have a little bit of a feel that we're making this up as we go along with, frankly, kids and their families' lives at stake here?
It absolutely does. And I mean, Governor Kemp has been a frequent foil here for any scientist or public health official that when we get asked, what's the problem here? Why are we still battling this when other countries can't have somehow figured this out? I look to Governor Kemp's example of poor leadership. I don't know why he's doing what he's doing, but to say that masks shouldn't be encouraged, if not mandated, in school districts across his state is foolish and is public health malpractice. To your point, Chris, no school district is fully ready. Even New York City, across New York State, they're better. They're in a better position to reopen because infection rates are lower. They're trending down. But do they have rapid testing on site for teachers and for students? No. And have a series after a series of scientific studies suggested that the only way to keep schools open is to have rapid point-of-care testing embedded in school districts? Yes. A great study that was just published last week in JAMA. Listen, Chris, here's the issue here. What you're going to now see across the country are school districts and universities that are haves and those that are have-nots. Places, school districts that are in affluent neighborhoods that can afford these rapid point-of-care machines, universities, elite universities that can afford them, and public universities and public school districts in inner urban city areas that will not be able to afford this. That is going to be the reality here. We need to face that. Our elected leaders need to deter against that through increased federal subsidies to make sure everybody's safe.
Well, let's talk about that school in Georgia, because they sent home a note, and two things struck me immediately. One was there was absolutely no mention of contact tracing. And in the Atlanta Journal and Constitution, the aunt of two kids who tested positive said, look, those kids have no idea who they were in contact with. You know, it's the beginning of school. Everybody's running around. You're in new classes. You're walking down the hall. So that's the first thing. But the second thing was no mention of testing. Let me read from the letter that was sent home to parents. If your child exhibits any of these COVID-19 symptoms, the CDC and DPH recommend your child be tested as soon as possible. In addition, please notify the school front office, as it is imperative that students who are showing symptoms stay home and quarantine. So not we're testing. Parents, it's on you.
Well, I think this is a fundamental distraction and unfortunately just not the right messaging from the DPH in Georgia. We know symptom-based screening is not enough the younger the individual is. In this case, for school-aged children, whether they're 18 or whether they're 8, if they're positive and transmitting the virus, they're likely asymptomatic. So searching and screening for something like a fever when you're likely not to have it if you're young is pointless. It should not be the backbone of a return to school strategy. Testing, distancing, ventilation. Ventilation is key. Chris, nobody talks about ventilation in school districts, especially public schools in inner urban city areas, because they can't ensure adequate ventilation. We don't talk, this administration and elected leaders across the country don't talk about things they cannot intervene upon, one of which is rapid testing, which is barely available, and number two, ventilation, which is hard to ensure robust presence of ventilation when often you have classes in basements. Often you just don't have great ability to ventilate. So there's limitations as to what we can do in a pandemic to safeguard the health of children.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.